Med News Journal, your go-to source for the latest updates in the world of medicine. IWSO is thrilled to be your host on this journey of discovery. Let's dive into the fascinating world of medical advancements together. Stay tuned for regular, concise, informative updates via this channel. The top 3 stories of today are: new study suggests long COVID fatigue linked to malfunctioning mitochondria. The common symptoms of long COVID includes post-exertional malaise, cognitive impairment, brain fog, sleep problems, and fatigue, which can have severe impact on a person's life. Massive number of plastic particles found in bottled water. Are they harmful to Earth? According to the new study, bottled water contained hundreds and thousands of teeny plastic nanoparticles. Could statins help slow down the development of dementia symptoms? Evidence coming from new studies. Statins are a drug that reduces cholesterol in the bloodstream, and while they are initially designed to prevent heart diseases and cardiac events, they are increasingly being used to prevent other conditions linked to cholesterol. Researchers from Amsterdam University Medical Center have discovered that the fatigue experienced by those with long COVID has a physical cause. At least 65 million people globally suffer from long COVID, where symptoms persist for months after the initial infection. Common symptoms include fatigue, dizziness, mobility issues, sleep problems, cognitive impairment, and brain fog. The lingering symptoms significantly impact person's life, with study indicating severe disruption in work, home, social, and private lives. Researchers aim to understand the physical basis of fatigue in long COVID patients, as extreme fatigue affected many individuals who were previously fully integrated into the society. In a recent study published in Nature Communications, the researcher conducted cycling tests on 25 long COVID patients and 21 healthy control. The test induced post-exertional malaise, worsening fatigue for up to 7 days after the exercise. Analysis of blood and muscle tissue samples revealed abnormalities including lowered mitochondrial function in the muscle of long COVID patients. Mitochondria is also known as the powerhouse of the cell, which produces energy for the body cells. The findings suggest a biological basis for the fatigue experienced by long COVID patients, providing insight into the potentially treatment avenues. Professor Michel van Vugt, co-leader of the study, emphasized the importance of acknowledging long COVID complaints, advising caution with tailored exercises, and supporting medical colleagues in managing symptoms. Dr. David Cutler, a family medicine physician, noted that long COVID is challenging to treat due to its poorly defined nature. The study contributes to reassuring sufferers that their experiences are physically real and not solely psychological. While research sheds light onto the biological underpinning of fatigue, the need for further studies and diverse treatments, including graded exercise, nutritional support, emotional therapy, is highlighted to address the complexity of long COVID. Now, let's go to the next topic of nanoplastic particles. A recent study has revealed that presence of hundreds and thousands of teeny plastic nanoparticles in bottled water, raising concerns about potential health risks associated with the ingested plastics. The study, utilizing a new detection method, identified 10 to 100 times more nanoparticles in bottled water than previously documented. The health effects of consuming these particles remain complex and unclear, but there are concerns about physical injuries caused by these particles rubbing against the tissues, as well as potential chemical hazards from additives like phthalates and bisphenol. Moreover, plastic particles may act as carrier of environmental pollutants, toxins, antibiotics, or microorganisms, leading to additional health issues once inside the cells. A separate study by Consumer Report found microplastics in 84 out of 85 tested food, indicating a pervasive infiltration of plastics in the human food chain. The study identified high level of phthalates in almost every food tested, with no particular food type of packaging showing higher susceptibility. With none of the tested food exceeded current safety standards, concerns were raised about the evidence-based nature of these standards. To reduce the risk of microplastic consumption, experts recommend avoiding highly processed food and beverages, switching from disposable plastic bottle to metal or glass, opting for loose leaf tea over tea bags, relying more on tap water with effective filters, and using glass containers for microwaving. Despite the findings, staying hydrated is considered crucial for health, and experts do not advise against drinking bottled water when necessary. In conclusion, the study highlights a significant presence of plastic particles, particularly nanoplastics, in bottled water and various food, posing potential health risks. The complex nature of the risk includes physical harm, chemical hazards, and the ability of the plastic particles to carry harmful substances. Awareness and avoidance of highly processed foods and plastic containers are recommended measures to reduce the risk of exposure to microplastics. Now, let's go to the last topic of the day, which is statins and its effect on dementia. Statins, initially designed to prevent heart disease by reducing cholesterol level in the bloodstream, have gained attention for its potential role in slowing down the development of dementia symptoms. Some researchers believe that common form of dementia, such as Alzheimer's disease and vascular dementia, may be influenced by changes in cholesterol metabolism and blood flow to the brain. High cholesterol, particularly in men, is linked to this form of dementia. Statins, by lowering cardiovascular and cerebrovascular risk factors, could potentially decrease the chances of developing vascular dementia. A longitudinal cohort study in Sweden investigated the impact of statin use on cognition in older adults with dementia. The study, published in Alzheimer's Research and Therapy, analyzed data from 15,586 individuals with various forms of dementia, finding that statin users on average had improved cognition over a 3-year period compared to non-users. Different types of statins were associated with different degrees of cognitive improvement. Despite concerns about statins causing confusion in older patients with dementia, the study confirmed that safety of statin use in this group and suggested that in the long term, statin might have protective effect on cognition. With the study provided invaluable sites, further research is needed to understand the underlying mechanism of statins' impact on dementia. Questions about how statins affect cholesterol, brain connectivity, and their effects with short and long-term treatment remain. The potential benefits of statins may vary among various different patient groups, and understanding how genotypes such as apoallele modify responses to statin is crucial. Future studies may provide more data on comparing specific type of statins to determine their effectiveness in preventing memory loss associated with dementia. We want to extend our heartfelt gratitude to each and every one of you for being a part of our incredible journey. Your support and engagement mean to the world to us. Thank you for entrusting us to be your source of medical news and updates. If you haven't already subscribed, kindly consider subscribing to our channel. Your subscription fuels our passion to bring you the latest and the most relevant information in the world of medicine. Stay informed, stay curious, and thank you for being essentially a part of IWSO family.